Well, hello, I'm Charlie Hull from the Blessing Health System marketing team, and today we're glad to be joined by Dr. Chris Wagner from the Illini Rural Health Clinic, and we're going to be talking about a hot topic right now, and that's the COVID-19 vaccine. And Dr. Wagner, first of all, thanks for joining us today.
Yeah, you bet.
You yourself have chosen to take the COVID-19 vaccine, and I want to talk through that process. I know that you, as a physician, you look at things from maybe a little different perspective due to your training than maybe someone off the street would. So, kind of what went into your mind in that decision? What type of research did you do on your own that made you believe this was something that was acceptable and something you wanted to go forth and have taken?
Yeah, so basically, like everybody, I've been following along with COVID-19 and through the whole process of when a vaccine was going to become available. I've always been a pretty big proponent of vaccines anyway, so of course I was interested from the beginning. And then as time went on, just like everybody else, I can read the news and see what's going on with Pfizer, Moderna, different companies, and then just spent more time reading, trying to read the science of it, trying to read the background of what the vaccine is, how they're creating it, how it's different than a lot of other vaccines, um, and ultimately felt that it made more sense for me to get it than to not. Um, when you talk about difference between, I guess, professional opinion about why to get it versus personal opinion. Professionally, of course, again, I'm definitely in support of vaccines. If we have an illness out there that a simple injection can dramatically reduce the risk of any of us getting it or having a significant illness from it, that just makes great sense, as long as that's something that's safe. Um, and so, I kind of felt if I'm out here pushing a vaccine or recommending a vaccine to my patients, to the general public, I don't feel I have much of a leg to stand on if I'm not willing to get it myself. And so, as soon as it was available, I said, sign me up.
So let's talk about the vaccination itself. Walk us through kind of what that was like and what you experienced after the vaccine, because I believe you actually have had both doses at this point.
I did. Back in late December, I had the first dose. Uh, it's a shot just like any other in the arm. That day, maybe I felt a little bit weird, and that's the best way I can really describe it. But if anything, I was a little bit tired for the afternoon. That was pretty much it. 21 days later, which was this past Friday, I got my second vaccine. This one, I will say, after the second shot, I felt a little bit crummy. I had spent the weekend, I got on Friday, so I spent the weekend with a little bit of body ache, a little bit of chills, slight headache, nothing dramatic. My arm was sore, definitely not worse than a tetanus shot sore, in my opinion. Um, but really, so this was on Friday morning, and by Saturday evening, I was able to run an hour on the treadmill and not be dramatically slowed down, didn't feel short of breath or anything like that. And by Sunday, I felt fine.
I think some of those minor side effects, in comparison to some of the things people have had to go through who have contracted the COVID-19 virus itself, that's a pretty simple trade-off.
Oh, absolutely, absolutely. Actually, we are seeing people die, of course, everywhere from it. My own grandmother died just a few weeks ago after a long bout with COVID. So, of course, you can see the dramatic impact that people are having by getting the illness, and not only even just dying. I'm seeing people that they were sick from it, maybe they were down for a week or so, but they're having longer lasting effects. They're excessively fatigued for a couple months, having this cough that just persists for several weeks. And then there's still a lot of ongoing research that's really going to take years to really iron out, of long-term heart complications, neurologic complications, things like that, that really, with this being a new virus, it's going to take several years to find out, is this virus itself going to cause us long-term problems?
I think some people would hear what you just said and say, well, couldn't you say the same thing about the vaccine itself? And to that, I think people can feel rest assured that while it seems like this was developed fairly quickly, it still went through a lot of the normal process that it takes to develop something like this.
Sure, and when people bring up to me concerns about, well, what about this vaccine, and 5 years from now, 10 years from now, am I going to have problems from it? I can't give you an answer. There really is no answer for that right now. And medical history has seen problems where a certain type of treatment seemed like a great idea and ended up not being. Um, this is a little bit different, though. This is on a global scale. We're not just talking about the United States and a couple companies in this country working on it. We're talking about uh, pharmaceutical companies, vaccine companies across the entire world that are in a dead heat race to find a vaccine that works. It did go through, when I say it, the two that are approved right now, Pfizer and Moderna, they've gone through a lot of testing. It's not that it just became available overnight in December. These studies have been ongoing for several months, tens of thousands of people involved. So there is some information that's already been available from it. Um, Not only that, this particular type of vaccine is different in how it works compared to, say, tetanus shot, measles, things like that. So typically, our vaccines would be a part of a part of a virus or a whole virus even that we're putting into the body so the immune system identifies it and then in future times when it sees it can fight it. This particular vaccine is really smart, actually. It shows our body how to create this protein, the same appearing protein that would be on the virus, so that when or if we ever come in contact with the actual virus, our immune system can attack this protein because it thinks that that's the same one that our body's just created. So, using this mRNA technology, it's not a new technology for the vaccines. It's been used in other medications, but it's a really cool endeavor that they've been on now.
If you can, just tell us. I know you talked about your grandmother, and obviously, our condolences to you and your family on the loss of a loved one there. Tell us what you've seen as a physician in some of your patients, and some of the folks that, while there are some high risk categories, this has affected some of those people who even fall outside of those high risk areas as well.
Yeah, definitely. And I've seen the gamut. I've seen people come in and say, yeah, I think I had COVID or I tested positive, had a little headache for a day or two, no big deal. Great. And I see those people everywhere from teenage up into their maybe 50s. I don't think I've seen too many people over the age of 60 that have really had, overly mild symptoms. And then I've had patients. I have one patient that I'm still waiting for him to be able to leave rehab several months later after contracting the virus. Otherwise, fairly healthy guy in his mid 60s, I believe he is. And like I said, I mean, several months later, I'm still waiting for him to be able to leave rehab to come in for a follow up on that. Um, and patients really tell me kind of a wide variety. Some, like I said, are still feeling tired a couple months later. Um, uh, a lot of people will say they still don't have their taste of or sense of taste or smell back yet. Um, I guess it's probably more of an annoyance than it is a problem. Um, but definitely the higher risk groups, the people that have lung disease to begin with, heart disease to begin with, people that are over the age of 65 or 70, um, they're definitely, a lot of them are a lot more concerned, for one, about getting the virus. And the ones that do get it, oftentimes are having more complications.
I know there are certain groups of people who there haven't been extensive studies done. They haven't done a lot of the trials. I think one of them that comes to mind would be women who are pregnant or who are maybe looking to become pregnant. And I think some of the information on that now is you really need to have a conversation with your primary care provider to talk through that to see if it's a good option for you.
Yeah, absolutely. And you're right. There are not yet any approved vaccines for kids under the age of 16. That doesn't mean that it's harmful to kids under 16. It means that it hasn't been fully tested yet. Same thing with pregnant women. I think there's been some misinformation out there that the vaccine is harmful to pregnant women. And that's not really the case. What the problem is that those studies just have not yet been done. As to my understanding, a lot of those are ongoing right now, and time will tell. I try to give people an honest answer and say I can't tell you if there are any long-term effects. As it stands right now, nothing is seen. Keeping in mind that there are people that have been involved in these vaccine studies that very likely have become pregnant since the beginning of this. And I'm sure they're being very closely watched to see are there any complications, are there any concerns with that?
I mean, obviously, we do want to make light of the situation, but I know that there's a lot of people who, you hear that they want to get back to normal life. And I know that you're someone who is a very avid sports fan. You're a person that likes to go to concerts. And so while those things aren't necessities in life, they are very important moments. And getting folks vaccinated against this type of virus is really, at this point, the only way we'll see those type of events come back for the masses.
Yeah, Charlie, I want to sit in a stadium and have an overpriced hot dog and beer so badly. Um, the faster that we as a country and world can get vaccinated can reduce the spread of this virus and the impact of the virus, the better off we're all going to be. I keep asking all my patients that come in, how was Christmas? How did you get to see your family? Oftentimes, a lot of people say we didn't. I'm seeing a lot more mental health problems, and I think a lot of it's from isolation, from not being able to just go out and go to the mall easily, be able to go to a movie. All these things that are part of our day-to-day life that have been either um, very much hindered or removed altogether. It plays a big impact on our mental health too, and I'm definitely seeing a lot of people that are just struggling with it.
In the coming weeks and months, as the vaccine becomes more readily available to different groups of people, we invite anyone who has questions to talk to their primary care provider. And I think that drives home again why it's so important to have that type of relationship with somebody you know and trust, because unfortunately you can't trust everything you read on the internet or see on Facebook or that sort of thing, but you can trust your own doctor.
Right. Right. Yeah, it's the world of social media is both horrible and wonderful at the same time. And you can get a lot of great information, you can get a lot of terrible information. And to me, the best way to sort that out is go to the experts, go to the people that are trained in the human body and in medicine. Go to your doctor and find out here are my concerns. What do you think about that? And just get their opinion.
Well, Dr. Wagner, we appreciate you giving us some of your time today and sharing about your own personal experience and also your opinion as a physician. And we hope this has been informational and helpful to folks. And again, if they have any questions, we encourage them to reach out. They can also call the Illini Rural Health Clinic if they choose to be able to learn more about if the vaccine is the right choice for them.
Yeah. Thanks a lot, Charlie.